Don't drink, don't smoke, and don't sit. Will that be a fair warning?
Absolutely, yes. And sitting is next smoking.
Why not be comfortable just running one clinic? Why put in the hassle of building a chain?
Trust me, one clinic cannot build a culture. And me, as an individual, here to create a culture among the people.
Welcome once again to the Healthcare India podcast, and I'm here with my good friend,
Thank you.
Dr. Anup Bhrahmbhatt, co-founder of Physiotherapy. Dr. Anup, first of all, welcome and thank you for taking time out. I'm personally indebted to you.
Thank you.
You know what I went through, and I think a lot of my readers have been listening about my swimming and
It's a journey in itself.
So I've been talking about it fairly. I've been telling them to look at physiotherapy very seriously. But this is the man behind the reason I'm back from my slip disc. So thank you once again for taking time out and for treating me.
Thank you. Thank you very much, Dr. Vikram. And I really appreciate your appreciation towards the field of physiotherapy, which has directly and indirectly helped you to gain the recovery journey, I will say. And I still remember the day when we met long back, and today we are comfortably able to sit across the table without pain. That itself is the biggest recognition for the protocol driven and scientifically backed physiotherapy.
Very true, very true. So one of the interesting things I read was 2 in 3 people in India will experience back pain. This was according to some research that was published, and the annual rate is almost 50%. So is it fair to say that back pain has become has moved from a clinical symptom to an epidemic now?
See, I will take your question in a 2 different dimension. The first is 2 out of 3 people getting into the back pain itself is a big thing for any country. Coming back to the data, that every demographic data, so whatever data we go through on a day-to-day basis, is taken as a overall as a worldwide data. But if you see India as a demographic where it's too much of diversity, so 2 out of 3, it's something like a huge. And yes, it is next pandemic. The spine issues, the back issues and neck issues are next pandemic. It is getting into that level where people are taking their back pain and spine pain as a disability issue. So that is really a concerning personally to me and all healthcare provider where back pain is now day-to-day problems.
No, you're absolutely right. Actually, I think there was a research done by, I think, Pain India. It's a report. And they said that neck and back pain is now one of the leading causes of living with disability. So my question is, if this is so apparent and it's been happening for a while, the buildup has been there, why is interventions brought by physiotherapy looked as a last resort rather than the first line?
So again, here the only issue is, I will take this question into 2 format. One is physiotherapy as a last resort. Yes, the reason behind this is affordability and accessibility. In larger part of India, as I said, India is a very diverse country.
Right.
In larger part of the country, especially tier 2, tier 3 cities, where the education for physiotherapy, where the education for physical therapy and prevention is better than a cure, these 3 theories are not still in people's mind.
Okay.
So if I go back to my 12th or PU in 2002, 2003, I still remember when I decided as a person to pursue my career as a physical therapist because I was inspired by one of the physical therapists of USA. I used to see a lot of his videos on the ground. So that was something which I thought, okay, this is something good work and let's do physical therapy. So when I said this things to my family, some of the people says, physiotherapy? It is like that massage karna hai and wax lagana hai, kuch exercise karna hai, that my measures can do, meri massage wali kar legi. So people in India is still not taking physical therapy as a mainstream or as a this stream can help them as a prevention is better than a cure concept.
Correct.
Coming back to your same question, that affordability. As a policymaker, as a larger group interest, even in our PHC, primary healthcare center, physical therapy has never got that importance.
Understood.
See how physicians are there in each PHC.
Right.
That is still many PHC don't have a physical therapy concept itself.
Understood.
Each policymaker of this country to make sure that physical therapist become a integral part of PHC. So our aim of prevention is better than cure can be visualized very proper way.
No, I agree with you. See, even if you look at total cost of ownership, if you once you have the issue and you go through surgery, it's quite a lot.
Yeah.
And I think physiotherapy, if you look at total cost of ownership, if I use a financial term for it, I think physiotherapy is a very cheap intervention as compared to going through the entire pain of surgery and everything else.
Definitely. And see, again, if we compare a surgery and if we compare a physical therapy, yes, definitely. But see, what happens is, as I said in previous question, the people belief, people understanding, the lack of education has gone on to that level where first stage, second stage, where physio can play a major role.
Right.
Where I can prevent you from the surgery.
Right.
That stage is gone because of the lack of education.
Right.
That accessibility is not there. So they'll end up into the surgery. And when they go to a surgeon, and if it is severe case of osteoarthritis grade 3 of knee or listhesis of grade 3, no surgeon will suggest for a physical therapy. So it has to start from the root level.
Right. Right.
The changes you and me are seeing as a vision, it has to start from a root where the education becomes important. We educate people, and I think we are sitting together today
It's
to
part of
educate.
it. Yeah, it's part of it.
Yeah. So, and if we educate them that any early stage of your pain, any early stage of your movement issues, any early stage of your mobility issues, where you feel that you are not able to perform your 100%.
Right.
So I always tell my team that you see how cricketers are disciplined.
Right.
Any sports player are disciplined that before any game they do the test, yo-yo test, or many tests are there. So they want to make sure that I am fit. So why the general population is not worried about the regular checkup with physical therapy? Are they fit enough to perform the day-to-day task? Right or wrong?
Very good point. Yeah.
There is a research done in UK or many western part of the western part of the countries and Harvard University especially, that the people with musculoskeletal pain are more prone to disability than anything else.
Okay. It leads to disability.
It leads to disability.
Understood.
Because a constant back pain, a constant neck pain can definitely lead you towards depression also. The person goes into a literal depression that anything I do, I'm not able to perform or not able to give my 100% to this activity. And slowly, because of the lack of knowledge and education, people either opt for the painkillers or the steroids and all. But if they are properly educated about their condition and if they know that this is an early stage of back pain, if I can meet physical therapy who can guide me on my ergonomic posture, how should I sit, how should I walk, how should I lift, how should I use a computer, and minor stretches can fix them.
Oh, that's a great point you made. If I compare it to what happened to me, what I suffered after the acute phase was over, after I understood, it was lack of confidence, right? You suddenly lose confidence that I'm not fit and something has happened. And what I think physiotherapy really helped me And I still do all those exercises,
Very
right?
nice.
Just to give you a caveat. But it gave me a lot of confidence back. And it gave me enough confidence that I now prescribe physiotherapy
Very good.
to everybody. I said, okay, before you go to orthopedician, and no disrespect meant, I have so many orthopedicians who are friends, good friends, classmates, but I always tell them to take an opinion, which brings me to my next question. So I was reading this report from the UK, which I think you had also shared. And one of the things they have prescribed as a policy is for surgeons to first consult or look at physiotherapy as a line of attack before you go to surgery.
Yes.
And the reason I bring it up is, knee replacement surgeries in India are growing at 20-25%,
Massive.
right? So, and just today morning, my wife was telling about a friend of hers who had suddenly rushed for some medical emergency, which turned out to be a knee surgery for some of her relative. Knee replacement, actually, not even surgery.
So knee replacement cannot be emergency surgery.
It can't be emergency. That's what I was thinking. That's the first thing I told her. I told Archana that it has to be elective because you decide from long ago.
Yes.
And then she said, I don't know, but this is what I was told. So when UK can publish a policy like that, you think it is too much for India to start looking at this as a policy decision that, hey, first consult physiotherapy and then you opt for surgery?
Definitely yes. India should have its own policy. See, if you
Right.
see our population, we are almost 140, 142 crore population as on today. 135 official, and you know that it is done old, and so we are almost 140 crore population. Even if you see WHO data or UN data of the demographic changes of each problem is different. India is a very diverse country.
Right.
We have a farmers also, we have a IT populations also, we have a Gen Z also. So every population in India, their problems for a musculoskeletal back or neck is a different.
It's different, yeah.
People who are sitting in front of the system, their problem towards the back and neck is different.
Correct.
People who are doing a farming work, their problem towards back and neck is different. Women's, because of the lot of hormonal changes, prenatal, postnatal changes in their life, they are always prone to more back pain and their problems are different. Coming back to your, I was just making a benchmark for you, but coming back to your question straight away, in UK, the population is very well informed.
Correct.
See, as we go to again our back question, our population needs that education. When we start educating our people, it will be easier for government to implement as a blanket level or a larger level. Apart from this, if our clinician, because what we follow, the Gray's Anatomy,
Cunningham's.
Shambulingam,
Yeah.
all that books are written almost 50, 70, 100 years back.
Incidentally, my mother read Gray's Anatomy.
See?
Right? So that's how old it is.
It is 100-year-old books.
Right.
We all follow that books and see, human anatomy is human anatomy. There is, you or me cannot change.
Right.
Kidneys are two, we cannot debate on that.
Right.
We are not here to debate whether human anatomy is correct or not. But is human anatomy book what we read, it is clinically correlating with the today's scenario?
Maybe
no.
not.
Maybe not.
There were no computers then.
Yes, there was no computer, there was no screen time. After coronavirus pandemic, screen time is become one more pandemic. you see the people goes virtually, you take yourself back 5 years before or 6 years before. Have you ever heard what is called Zoom Meet or Google Meet?
No.
Hardly some people.
Yeah.
So now Google Meet is like a day-to-day lifestyle. So we should always correlate what we studied and what is today's relevancy.
Correct.
But unfortunately, people or our clinicians don't want to go back or don't want to move fast forward and see what is today's day-to-day problem, what is called lifestyle disorder.
Correct.
Your back pain and neck pain has become a lifestyle disorder. Sir.
Correct.
It is not like हमने कुछ लिफ्ट कर दिया और हो गया. There is no proper lifestyle for the people. I get, if I give you a randomized idea of data, what we see is out of my 100 patients, 80% patients sits in the front of the computer more than 10 hours.
Correct.
So back to 100 years, they all were mobile. So the back pain and neck pain was not that relevant. Now coming back to the same that yes, Indian clinicians, Indian physical therapist, Indian occupational therapist, dietitians, surgeons should come together because it's a again
It's an ecosystem play.
it's an ecosystem. No one person can change this entire ecosystem where equally you need the collaborative work between the surgeons, orthopedic, physical therapists, dietitians, all should sit together, understand the importance of this entire cycle,
Correct.
and create that awareness. So if any patient with early back pain comes to a mild to moderate case to a orthopedician, rather than he prescribe what you should do as a physical therapy, let him refer to physical therapist.
Correct.
So if you go back to USA culture, they don't write the medicine name.
Right.
They write the ingredients.
The pharmacist is supposed
to give the medicine. So it is always about the mutual respect to the community and healthcare industry. If they start evolving with this, I'm sure we are so humanly touched people. Indians are so humanly touched people. We normally don't need any kind of papers. We have to trust each other on their recovery journey. So if it becomes an ecosystem that this is the first line of care, we can solve major surgery. Coming back to your second question, where 20 to 30% year on year knee surgery or TKR, total knee replacement, is happening. That's something which is like shocking.
It's shocking to me
It
too,
is
because
shocking.
in the 90s, right, when I started studying in medical college, we used to hear about cases. Like maybe we did about 10,000, 15,000 a year, but the number is gone way up. I don't have the exact figure, but it's like a 25% growth year on year.
Again, the early stage of education plays a major role here. See, any TKR or any arthritic changes in the body, there are three factors are mainly involved. That means one is your good diet, your posture, and your overall lifestyle.
Correct.
As soon as a patient comes to you on an early stage of knee pain, how clinically you explain him on obesity if his BMI is high.
Correct.
Because major of the cases we have seen that if it is early stage of arthritis, obesity plays a major role, because when you lift or when you carry the extra weight on your abdominal area or a central obesity, it puts a lot of pressure on the knee, and that's how the whole cycle start.
Right.
So we should educate, or it is a responsibility of our clinicians, our frontline orthopedicians, our doctors, our surgeons to educate about the requirement of exercises, the food, the lifestyle changes, and most important thing, that posture. That ergonomic advice plays a major role, and that's where I always tell that if they come or knock a physical therapist door at the right time, right place, 30 to 40% surgeries
Can be avoided.
And it is blessings for the family.
Yeah, because its life is not the same.
Yes, and you reduce your financial constraint. You see 40% of surgeries, if early stage education can reduce, you can become more financially strong, na? Right or wrong?
Very
Today's
true.
any TKR surgery, I'm just talking about the person who don't have the insurance, it costs around 3.5 to 4 lakh rupees.
Correct.
If you see 4 lakh rupees a surgery can be avoided by just a 10 to 12 days of early intervention of the exercise, it's nothing less than a blessing.
It's good. It's great ROI. Exactly. So let's switch gears to something. Nowadays you can't keep away healthcare and AI.
Oh,
Yeah. So I'm gonna trick you into this. So I understand. I mean, I totally believe in your vision, what you're doing, but how are you integrating AI and advanced technologies into your protocols for physiotherapy? Because we have to move with the times. That's what you said.
see, AI is here, and we all, means as a physical therapist or as a healthcare provider, I look up to AI. because AI going to be a game changer. But as I always said, and as I read also in the books and my understanding of 20 years, technology can be a good also, technology can be a bad also. See how people started doing or reading a Google for their back pain or their problems and creating a problem. Because each individual is a different. What back pain I might go through, it cannot be the same what you go through.
Correct.
Because your profession is different. My profession is different. My way of working is different. My nature of injury can be different. But when you go through the online and do a lot of research, it comes as a subjective ideas. It doesn't give you the objective or personalized idea.
Correct. Absolutely.
Coming back to the AI, yes, AI, motion tracking, the tech, wearable tracking, it's like massive and it is going to be a game changer. But again, affordability with upcoming new smartphones and integrating them into a good apps and educating each individual to track all this can be a really blessings. So with new government policies, the phones are accessible, Android phones are accessible across the age group of the people. But scientifically doing a research with the help of AI, bringing the culture of motion tracking into the app, where without buying too much of stuff, a general population can track this all movements and can track their problems of musculoskeletal with simple solution of mobile will be a really blessings for India. We as a technology, we are still not a technology leader in the global market. We should again go back to our roots and educate the people about the technology, how technology can impact in their life. So that will be a game changer. And yes, we started, many of the clinicians started using AI for the lot of prediction, and it is helping.
It is helping you too.
It is helping. It is next level people are using it in a right way. It is good.
Excellent. So you said the right way, and you said somewhere you wanted to build that culture, education, awareness. So as you scaled up, and we know that you have now 22 clinics, which is phenomenal.
Thank you.
And it's fairly quick time. You went to 22, from 1 to 22. And also gives me a sense that you're a man in a hurry, right? So what were the typical scaling challenges you face? Especially, the ones I really look at is hiring the right, therapists, the right practitioners, then maintaining quality across 22 units, and then your protocols, which you have established and you run them very effectively. So what were the challenges that you faced? Which was the biggest challenge you faced?
Let me take you back to 2021, where after almost 10, 12 or 14 years of working with the people and the institutions from one to other, that's where I feel that there is a gap in Indian physiotherapy market, where there is no protocol driven, the recovery roadmap is given to the patient. So the first challenge, I always feel that acceptance, that can physiotherapy or physical therapy be a central point of recovery context. This was the first questions or first hurdle what I always faced in 2021 when we started with the first clinic in Sakar Nagar and then in Electronic City in 2021. August 13 was the day. I still remember.
August 13th. Oh, very interesting.
People were not ready to accept that physical therapy is a wellness. Physical therapy is a necessity. Physical therapy can make you move properly. That was the first hurdle. Coming to the next hurdle or the process, every step of this 22 clinic to scale it up to 22 was always a challenge. From it should be a protocol driven, scientifically backed technology, integrating a technology, making people understand a technology. Because see, physical therapist at hospital level never got that prime focus for the recovery agent. Means they've been always been treated as a paramedical staff, not given that accessibility to the records, reports of objective analysis. So my first challenge to make my team understand that we can do it. You see any data of whether it is Ireland data, Australian data, USA, UK, Canada, any data, NHS data. I really appreciate the UK government has taken a physical therapy in a next
In a
level.
very big way.
Very big way. So NHS data. That took me a long time to create that positive mindset in my team that we can do it. Let's take this as a challenge. So to create that culture in people's mind that we can do it, but let's do it scientifically. No treatment in the air, no magic, no wrong promise. So the culture, hiring a right candidate, making them mold according to my philosophy of delivering the best human care, and of course integrating a technology, usage of AI, usage of software, usage of best tech available in the market or in the world, and giving a best to the team. So that was a journey, but yes, I really appreciate my co-founder Sandesh Kadabams also, who comes from a mental health background and who understood that there is a gap between the physical therapy market also. So he was always, because he back in time he was on the NHS board of UK. So he used to always help me to understand or analyze that physical therapist can become a frontline warrior if we do it in a right way with objective analysis.
Correct.
And that's where we all are here. From 1 to 22.
And one of the interesting things was when I came to you the first time, and Anshu, who's our mutual friend who got the appointment for me, I have to mention him here. He said, Dr. Anup has German machines and they can analyze anything. And when I came to you and you looked at me and you asked me a few questions, you did your diagnosis. And I asked him, do I need the machines? You said, no, I can see what is wrong with you, which is interesting protocol, because you were not thinking of overcooking up in the air, like the words you just now said. You said, okay, this is what is wrong with him. I can make it out right now. And you explained to me that entire center of gravity thing, which was an eye-opener.
Correct.
All of us have read physics, but sometimes we forget.
Yeah.
And so my point is, what was that moment? You've been working as a physiotherapist, and you did a lot of certifications. You did your masters, and you have experienced everything. Like you've done yoga, and you have certificates on yoga. So it's not like not like some of us in medicine. We have only one line, and we've gone in the line. You've gone it holistically. But what is that one moment that you said, okay, I'm going to start a chain now, and I'm going to go for it?
So the moment that spark started when I used to sit in Jayanagar in 2021, January, February, with one clinic back in that time. And I have understood one thing, that clinical excellence or best clinical practice will not be really able to create an impact in society. See, I sitting in Jayanagar, calling my patient from Hebbal to treat, because since you told Anshu's name, Anshu used to travel from Hebbal to Jayanagar.
Yeah, he told me.
2 hours one way, 4 hours two way, and 1 hour of my treatment, almost 5 hours. So I am eating my person's or my patient's half day, which can be more productive for him to earn bread and butter. That's where I really felt that, look, clinical excellency and calling a patient from one end to other end will not make a sense. Let's be a more accessible, let's be a more affordable, and let's be a more scientifically driven, where you can convince the people that what we are doing today is not something of magic.
Right.
It's a human motion. It's a human tracking. It's a human biomechanics. Coming to your point, where when you came and met me first in Sarjapur, I still remember that you were telling Anup, I really lost all the hopes, and I met so many orthopedicians and tried medicines, and you being a medical doctor himself, you will be knowing better a human body and anatomies. how you can quickly judge without any scanning, MRIs, X-rays and all. See, there is definitely a need of MRIs, X-rays. I always give that credit to our radiologist or our orthopedicians to do an in-depth analysis. But as a physical therapist, my name itself is called physical therapy. If I don't touch you physically,
How will you know?
how I will know?
Yeah.
And MRI report can read what is underlying inside the body. But how you are placed physically, how is your biomechanics, how you are walking. If I don't track that muscle chain, see, body is again a muscle chain, kinetic and this. If I don't understand that your gait pattern, so interestingly, now to make it more objective, we have developed AI tracking motion.
Yeah, I saw it that day.
I showed you that day.
Yeah.
So I can my camera motion tracker will give me the correct analysis of your walking pattern. So according to me, if I read your biomechanics, if I understand your center of gravity properly, my 80% problem will be solved. Because to give or deliver a best results from physical therapy point of view, accurate diagnosis is more important.
Right.
If your diagnosis of your root cause is not correct, whatever you do, it will all go waste. Because painkiller can reduce your pain.
Can't solve the problem.
Can't solve the problem. If you don't know that because of my constant forward lean sitting posture, my back pain is coming, you will take a painkiller, pain will go down, but if you don't change your habit,
It'll remain the same.
it remains the same.
Yeah,
So I have to do fine tuning, which we did in your case, and I think results were amazing.
Yeah. Results are totally out of my mind. And the beauty of the whole, what you're saying is, see, a mechanical problem only has a mechanical solution.
Yes.
That's one takeaway I have very clearly
Yes.
from your thing. The second very insightful thing you told me when I went with my MRI, and this is true for everybody who's taken an MRI. First of all, the MRI is a very scary experience to take it, right? You're alone, you're lonely, and there is that noise that comes along with it.
Yes.
And I'm sure my friends from medical device companies are listening to me. They'll probably do something about it. I wrote to quite a few of them after I took the MRI. But the important point is, the amount of time it took me to get the MRI, which was almost 45 minutes, and then development. My orthopedician, obviously, rightfully, because he probably had one look and he knew, he would have spent less than 1 minute looking at it.
Yes.
Right? And this is what you pointed out right in the first interaction.
Yes.
And that was the irony of the whole thing. So I go through a 2-hour or a 4-hour exercise to get my MRI. And in 30-40 seconds, the doctor looks at it and says, this is fine.
Yes. So my always, whenever I discuss with the patient also, see the time my patient spend on that MRI cycle.
Right.
And time a doctor spend on reading that data there is nowhere matching.
Right.
I have heard from many of my patients that doctor even don't look at the films. Sometimes doctor don't even look at the report. So see, I'm sure there are so many good, very well educated orthopedicians, doctor. They spend that good amount of time to make them understand our team at different locations. And me personally believe that MRIs, X-rays are definitely a good diagnostic tool, but you have to spend and invest that time on reading the data, reading the underlying cause behind. So if you see, many of the reports says, please correlate clinically.
Yes.
It's
a caveat behind
yes,
everything. Yeah.
Your radiologist themselves says very clearly, please correlate clinically. So if there is a disc bulge, I really still don't understand how people judge disc bulge will have only either painkiller or take a steroid injection. If that don't work out, lie down on the bed, I'll remove the bulge and you will be all right. But with removing a bulge, problem will solve? No. Problem will be solved when you educate a patient that what was the reason why this bulge just happened. See, whether the patient needs surgery or not, that is a debatable. We can debate on that. And I always respect that if it is not my case, if it is not treatable by a physiotherapist, physical therapist definitely should tell a patient that we cannot do anything about this. Please reach out to the orthopedic surgeons. They will help you. They are the best person to do a surgery for this. But if it is an early stage of minor bulge, or if it is a grade 1 or mild to moderate problem, physical therapist can play a wonderful role. Especially you have seen,
Yeah.
it is a personal experience for you. If any doctor prescribe a X-ray, MRI, blood report, and if they don't spend that 5 minutes to correlate with that physical test, to check the SLR or slum test, or there are a number of physical tests to rule out whether the disc radiculopathy or pathology is involved or not, it will not solve the problem. By just getting MRI report out,
It doesn't help you.
it doesn't help. And trust me, many of my patient, they says that after reading my MRI, my pain has gone up. Because that is a mental trauma to see that you have so many problems. Because they all are lemon. They don't know about what is actually causing you the back pain.
Correct.
What is the actual reason behind your disc bulge. And
Correct.
by just doing fine tuning, you can actually avoid the surgery.
I agree
And
with you.
even if you go NHS data, or if you go any global research data, they says the early intervention of physical therapist or conservative management can reduce a burden of 30 to 40% surgeries in a musculoskeletal conditions.
I totally agree. I mean, I think, see, there is an overall cost to it, right?
Yes.
Even if there's insurance, somebody's paying for it. There is a cost to the patient.
Yes.
There's an opportunity cost.
Yes.
Once you're under surgery, you can't do anything for a couple of months.
Yes.
You have to take all those precautions. Your quality of life comes down.
Yes.
And after any surgery, recovery time, and then you have to go back to physiotherapy then, right?
Yes.
Because
again, you will have to choose the route of physical therapy only.
because that's how knee surgery is brought in. So my question to you, and this might be slightly controversial, when I talk to a lot of healthcare leaders and investors, there is a lot of interest in various parts, oncology, digital health, a lot of investor interest is there. But do you see the same kind of investor interest in, say, something like physiotherapy? Because in reality, it is a commonsensical approach. The first thing should be physiotherapy, and then you go to the rest. But you know the story with our corporate hospitals and PE firms. It's very hot. Do you see the same interest from investors in your area?
So, yes, I definitely understand that there is a question of saying that there is no too much of interest in investment in physical therapy field. But I differ from this statement that there is a lot of opportunity in physical therapy. See, if you go by Indian government data itself, that by 2030, our 32 to 33% of population will hit the geriatric age group. Okay? So, and we are 140 crore population.
The volumes are huge then.
Volumes is huge. For physical therapy, it is not always about one joint. So if you talk about cardiology, it is always about heart. If you talk about the nephrology, it is always about the system of the nephrology which is related to that. But for a physical therapy, it is always about the entire musculoskeletal structure, respiratory structure, cardiac rehab, post-surgical rehab, pre-surgical rehab. See, if you see the Indian market, still there is no aware of pre-procedure rehabilitation. If you see the Western culture, even if you are going for a surgery, they prescribe pre-surgical physiotherapy to make you understand the process, to strengthen your bones and to strengthen your joints and to strengthen your muscles. So when a person goes for a scoliotic surgery in the UK or Western part of the world, first 15 to 20 days or 1 month is a prehab.
I've never heard of this.
Yes, it's prehab.
But in India, we don't do it.
Yeah, people don't see it again. For, as you said, for so-called corporates and the big hospital, for them, it is all about to do with their targets, their numbers. But it is all about the human emotion, how you are preparing a person for a surgery. Are we really looking back for that scientifically data that we as a this corporate house have done this many surgeries. This was our successful ratio. This is what we have done. I have never come across any hospital chain coming and saying that in last 1 year this was my surgical data, this was our objective analysis, to create awareness about the people, among the people. If they start doing a prehab, post rehab, the recovery or the value of their surgery will go up.
Correct.
People respect towards the surgeon will go up because they see surgeon as a god in India.
Right.
So when they do a surgery, I still remember one of my uncle was going for a surgery and my auntie was touching doctor's feet that please save him.
Yeah.
Definitely doctors
Fairly
are
common.
respectable, and I personally believe that they are God's messenger here. So we should respect, but are doctors ready to take this? This is debatable.
Ready to become God.
Yes. that is one more question. And if they integrate prehab, surgery and post surgical rehab, that becomes entire cycle. So physical therapy in India is going to be a next boom. It is one of the best for any investor to invest and get their whatever their I don't get involved into that 3x, 4x, 5x and all. For me, all this X is extra when you cannot impact patient's life or recovery journey. For me, any X is X if I'm not able to create that recovery impact on patient's mind or in his life. But if you see from that investment point of view or from the returns point of view, physical therapy in India will be the one of the most lucrative field for any VC or any investors to get the returns because market is massive. 142 crore population into 5 major joints. Your shoulder, your knee, your
Hip,
neck, back and ankle. 5 major joints.
Back you including hips also.
Yeah, almost 800, 900 crore population you are targeting means it's a massive.
So into 5, it's 5x and already.
Yes. So they should look at this with, of course, a good tech which can scale the business. See, that as an investor or any PE or any VC, when they invest in any fund or any company, they always see the company's vision or what they are planning to do or how they are planning to do. But for me as an individual, if you ask me, they should always see the potential of the market. Whether it is scalable or not scalable, it is a secondary. It is a structure what as an investor when they come, or whether it is they come as a strategic investor, they sit on the table and decide the strategy to scale it. But first is TAM. They should see the total addressable market. And for physiotherapy, TAM is like massive.
Unlimited TAM.
Unlimited. So you select a 10 house in this area where we are sitting. You can do a survey. Every house will need one physical therapist. Because physical therapist is not only for one particular age group. From 0 to 1, when there is a pediatric physical therapist needed, when there is early intervention for whether it is delayed milestone or whether child has not achieved that milestone where you need a pediatric physical therapist, then your adolescent, your scoliotic changes and all, then your adult when you get that early back pain because of the screen time and all, then your early 40 where you do a lot of flexibility issues, and when you hit a wrong gym and you come back to the physiotherapy. And then your geriatric age group, then your women's health involved, then your prehab involved, then your post-rehab involved. So physical therapist is everywhere. The TAM for physical therapist, there is no question on this. It is scalable. We are an example of it. From 1 to 22, bootstrap, it is scalable. But from 22 to 100, still it is scalable when you have the proper roadmap to your process, recovery plans, convincing plan, and it should be a holistic approach.
Correct.
It cannot be a one approach of only you have to do this.
Right.
So that initial 3 years of struggle, what we have, me and Sandesh has gone through together. Now we are at the stage that what we did in past 3 years as a bootstrap from 1 to 22. Now we will shift our gear and look from 22 to in 2030 we should hit 100. That's the target we are looking for, that physical therapist or physiotattva should be accessible to each city with the best protocol driven, best scientifically backed treatment and soap driven treatment for the people. So it is investable, and I can assure you that if it is structured proper way, any VCs will get a good exit. So don't worry.
If VCs are
I am not
listening,
the economist, or I'm purely talking from my heart when I talk about the funding, because I'm not the guy who talk about funding and the accounts and the marketing and all this, because I'm a pure clinician
correct.
and I want to be a clinician. My other part of the body, Mr. Sandesh, takes care of all this, my burden, and I just flow with my clinical work.
And one thing I will not mention here, and
Yeah.
nor should you,
Yeah.
is how you choose your locations. Right? That should remain a trade secret.
That
Because
is
I've understood. I mean, we discussed about it quite a lot, but I think that's a brilliant strategy.
Thank
And that,
you.
what that reminds me of. One is that entrepreneurship or scaling from 1 to 22. It's a lot about being receptive to the market, understanding what is happening, and you saw a pattern.
Yes, I
Right?
saw the pattern. Plus, see, for me, when I selected a physiotherapy or physiotattva to become a known brand for any physio need or family physiotherapist. So when we go back to a 30 years or 40 years, there used to be a family physician.
Right.
I want to be a family physiotherapist brand.
Brilliant. I like it.
So that is something which me and Sandesh were very clear about it. Coming to a select of strategic places where it has to be, it is always on the table discussion with our clinical team, our tech team. Sandesh takes a lead here, and we all sit and understand what should be and how it should be. But on top of all this, our always priority was physical therapy should be the core focus here. So if you see any corporate house and any big hospitals, for them, physical therapist will be either in their basement or in their one corner where nobody wants to go there.
Correct.
Let me be very honest. So none of the hospitals now they started doing, because they themselves see that there is a growth and revenue pattern involved. So they started giving that leverage. But going back to 5 years or 10 years, none of the big so-called corporate hospital, well-structured hospital used to give a space for physical therapist in a prime place of hospital.
Right.
It used to be always either in a basement
Or in some
or in
corner.
some backyard or a corner.
I think Artemis is an exception, right? They are the first corporate chain that looked
Correct.
at it very seriously.
Yes.
Yeah, I
Yes.
like that about them.
Yes. Nobody took physical therapy so seriously that we are taking it now. And we want to make larger than life for a physical therapy fraternity, where down the line, 20 years, 30 years, any juniors from my fraternity come and they see a physical therapy game changing, they should always look up to physiotherapy and say that I want to be a next physiotherapist. I will really appreciate them, because I want to create that benchmark that physical therapist also can be a core function of your recovery part.
Absolutely, I agree with you. And that brings me to my last question for today, at least. What is the one message you want to give out to other health entrepreneurs? We have so many young, dynamic people in India, the Gen Zs, the millennials, who are challenging status quo in healthcare in many ways, like the way you have challenged, in a way, right? Though you're part of the system, but your approach is slightly different. So, what is the one or two things you want to leave with them?
Entrepreneur journey, business journey, money comes, money goes. You are successful, not successful, possible, impossible. That all are becomes subjective later. We all should learn, or whoever is listening me today, or my juniors, my seniors, my fraternity people, or any healthcare provider, service provider, should understand one thing very, very importantly, that we all are human first.
Hmm.
Your service, your treatment should have a human touch.
Hmm.
If you lose that essence, even if you are successful, you cannot reach to the level where you wanted to reach. So, first, have that basic principle of life called values and virtues of a human touch. If you are a good human, if you have that empathy care towards your patient, that I want to do something good for my patient, see, money will come, you will be able to scale it. If you have that right and vision, or if your right mission with the proper clear vision that I want to achieve this, but there has to be some baseline. You have to start from somewhere. If you want to start somewhere, you have to have the basic patience to listen to your patient. That human touch, the values, the virtues, everything. See, the problem with this generation is everything revolves around money. See, money becomes end product. Money will fall how you want to get fall. But first is you have to become that patient-centric approach. You have to have that human touch. If you don't have a human touch, and if you are not able to understand people's requirement, and if you become more of an objective towards that, okay, this, do that, don't see proper reports, and to make it more transactional, that's where really shaking me up. And I really give advice to this young generation. Any progress or any success will fall wherever you want to reach, but first we all are human. Don't lose the essence of humanly touch. If you don't lose the essence of humanly touch, I promise you, you all will reach to the best place wherever you have visioned it out.
No, absolutely. I agree with you. I think it's a very strong message.
Yes.
And I like the fact that you directly spoke to these younger entrepreneurs. I think what differentiates us, and I always feel that what differentiates us from AI
Yes.
is empathy, is how we feel as human.
Emotion.
The connection, the
Yes,
emotion.
connection.
Right? We are not rational. We are
Yes.
not economists, one of the rules of economics is all men are rational. You'll work to maximize your profit. No, you don't.
Yes.
You get emotional in certain situations. You trust certain people.
Yes.
You don't trust certain people.
Yes.
Right? So I think as young entrepreneurs, what you're saying is empathy, gaining trust for the patient,
And proper hearing to them. See,
listen to them.
because many times, like when I treat some old age people, and see, we understand what they are going through. Top of the physical trauma, what they have bigger mental trauma. They go through like a hell. Sometimes when you listen to them, sometimes they just hug and cry. I see many of that old age people when they are going for a back pain, and after 3-4 sessions, they just come and hug that doctor. I'm pain free now. Thank you very much. That emotions makes me more happy than any kind of successful journey. That gives me a better sleep. So this is a success mantra for anything is give that give that ear to them, that I am there, you don't worry. So the basic funda is ABC. A for availability, B for behavior, and C for clinically driven. Don't give them a wrong hope. Your behavior should be best, a human behavior, and availability. Whenever they have some question, don't turn your face and run away from the question. Answer them. If you don't answer, then they will replace you by AI and Google for sure. Am I right or wrong? So ABC is the clear funda. That's where we are.
Great, Dr. Anup. Amazing discussion.
Thank
I
you.
don't know where the time went.
Yeah, I am sure. Yeah.
But thank you once again taking time
Thank you,
out.
thank
and
you.
Looking forward to having you again.
Always there, always there. Wherever we can create a bigger impact on the society and community on a larger extent to create the education, and if it can create that impact on their life, I'm always there.
Great. Thank
Super.
you once again.
Thank you very much.